Alright, so now, unsoundness of the limbs. Now, if you've been around horses for any amount of time, you know that if anything's unsoundness is going to occur, they're going to occur in the legs. So, starting with capped elbow, sometimes called a shoe boil. This is a blemish at the point of the elbow. It's usually caused by injury from the shoe when the front leg is folded under the body while the horse is lying down. Shoes with caulks or heels cause more damage than those with just plates. Next is camped out. Too far back and behind the plumb line, usually the whole leg is involved. Often accompanied by upright pasterns and straight hocks in the hind limbs, causes increased concussion on the navicular bone, pastern, fetlock joint, and hock. Camped under is the exact opposite condition. And this poor horse, as you can see, would probably be on both front and back. Buck-kneed, also called over at the knee, can be the result of a shortening of the muscles on the front of the knee. It can be present in foals, but usually disappears in the first 3 to 4 months. If congenital and a permanent condition, which is what congenital means, the forwardness will cause excessive strain on the leg. Calf-kneed, a deviation of the knee joint behind the plumb line so the leg is not straight. This places great strain on the tendons and ligaments running down the back of the leg. Compression of the bones in the knee joint also increases, leading to chip fractures. Horses generally unable to tolerate heavy work. Chip fractures. This can occur in several different places, but are most common in the knee. Most common problem that affects the knee. Small fractures that break off one of the bones of the knee. Usually created by high amounts of concussion and stress on the knee, and seen most frequently in racehorses and or horses in high-stress jobs. Now we have splints. These are inflammations of the interosseous ligament that holds the splint bones to the cannon bone. The most common in the forelimbs and usually occur on the inside of the legs. Usually associated with conformation problems such as bench knees that place increased stress on the inside of the legs, trauma, or hard training. Trauma usually occurs due to slipping, being kicked, jumping, and playing hard. It's commonly seen in horses 2 to 3 years old. Other signs of splints include pain, swelling, and inflammation. Bucked shins. This occurs on the front top part of the cannon bone below the knee. The forelimbs are affected more often than the hind limbs. This is caused by trauma to the surface of the bone, possibly from stress on the tendons that run down the cannon bone, or possibly from the forces distributed up the bone during fast work. They can be mild or severe depending on levels of stress. The greater the severity, the longer the rest and controlled exercise program will be needed to be extended. A quitter. This is the festering of the foot anywhere along the border of the coronet. This may result from a caulk wound, neglected corn, gravel, or nail puncture. Next is wind puffs. Wind galls or road puffs. These are soft enlargements located at the ankle joint. They are due to enlargement of the synovial sac. Synovial fluid, of course, being what lubricates joints. Alright, on the bottom of the feet, you also have corns. They appear as reddish spots in the horny sole, usually on the inside of the front feet near the bars. Advanced cases may ulcerate and cause severe lameness. They are caused by bruises, improper shoeing, and contracted heels. Now, moving on to upward fixation of the patella. This is also known as stifled. This occurs when the patella is moved above its normal position and locks into place. This prevents the horse from flexing its stifle, and the stifle and hock is extended. The horse will drag its leg since it cannot flex it and bring it back under the body. Young horses may grow out of it. Older horses must have it popped back into place carefully. This is thought to be an inherited problem due to straight hock conformation. It's also seen in poorly muscled horses, so conditioning may ease the problem. The hock. This is the most vulnerable and most important joint of the horse's body. All the power is generated from the hock. And structurally sound hocks should be reasonably deep from top to bottom, well supported by fairly large, flat, straight bone, and characterized by clean-cut, well-defined ligaments, tendons, and veins, and free from induced unsoundness and blemishes. The capped hock. This is a thickening of the skin or large callus at the point of the hock. It is a common blemish. It results from bumping the hocks when the horse is being transported in short trailers or unpadded tailgates. A curb. This is an enlargement of the back of the leg just below the hock. It is caused by trauma that causes the plantar ligament to become inflamed and then thicken. Seen with faulty conformation such as sickle and cowhock, and horses that slide too far or too fast in deep ground. Direct trauma, such as a kick from another horse or the horse kicking a hard object, may also stress the ligament. Bog spavin. This is a serious discrimination. A soft, fluctuating enlargement located at the upper part of the hock, due to a distension of the joint capsule. The result of horses trying to straighten the hock and trauma such as quick stops and turns or getting kicked by another horse. Bone spavin, or jack spavin. This is a bony enlargement at the base and inside back border of the hock. A common unsoundness of light horses, especially those with sickle hocks or shallow hock joints. In early stages, lameness may be apparent only when the horse has remained standing for a while. The bones may fuse and render the joint inarticulate or unable to move. Osselettes. This is the soft swellings on the front and sometimes sides of the fetlock joint, due to injury to the joint capsule of the fetlock. This trauma affects the surface of the bone where the joint capsule attaches to it. Tearing of the joint capsule causes inflammation that stimulates the bone to heal by laying down more bone. pedal osteitis. This is a condition caused by chronic inflammation to the coffin bone, usually in the front foot, usually due to persistent pounding of the feet, chronic sole bruising, or laminitis. Usually detected over the toe of the coffin bone and is caused by a decrease in the density of the bone in response to the trauma. Cocked ankles. This may appear in the front but are more common in the hind legs. Severe strain or usage may result in inflammation or shortening of the tendons and a subsequent forward position of the ankle joints. Advanced cases may impair movement and decrease usefulness. Flat feet. This type of conformation lacks the natural concave curve to the sole. More predisposed to more contact with the ground, increases the chances for sole bruises and resulting in lameness, more common in the front feet than the rear, and corrective shoeing may easily alleviate the problem. And there you have it, the unsoundnesses and blemishes of the limb.